Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion.
Wow, he's singing it even now. Okay, Brad, we've had a lot of videos on plantar fasciitis lately because my wife has it. And all these things we were doing were helping, but it wasn't taking it away, and it was just being stubborn.
Right, and we have a list of all those things on one of our videos.
Yep.
On our plantar fasciitis video. But what was the key for her?
The thing that finally put her up over the edge and it finally got better is we did get her a dorsal night splint, an adjustable dorsal night splint. And this is a splint that you wear at night and actually puts a little bit of stretch on your foot all night long so that when you get up in the morning, you don't get that sharp pain that people normally get right away.
So if you get up and you go like this and it really hurts for that first 10, 20 steps, this may be a good key.
This may be the trick. And now with her, in her case, again, she's probably had this, I bet you 6 weeks, Brad.
Sure.
And you know, my wife likes to run, and she couldn't run anymore. She couldn't even walk to a large extent.
Sure.
Within a week, she was running again. I mean, it really was dramatic in her case. I mean, it really made a big difference. So I went to look on the studies too on this, and what I found is the studies were a little bit mixed. But in every case, what they did say, if you use the splint, you need to do all the other things too.
Right.
You need to do the stretches, you need to ice, you need to maybe use an anti-inflammatory, which I'm not big on.
Soft tissue work.
Soft tissue work, all those things. Do those, which she was doing, add this in, and then, you know, you may be golden.
Right.
So this is the one we bought. I'll put a link down to it below. I really don't care which one you get if you're going to try it. You know, they're all probably going to work.
Yeah, there's probably 10 or 20 different models of these.
This one had a pretty good, you know, had 4.5 stars, I think. And what I liked about it, it just looked less bulky.
Bob, you forgot the strap here.
Did I forget a strap?
That drives me crazy. Let's get this thing on there. There we go.
There we go, yeah.
Okay.
So the big thing is, you know, these are all adjustments on here so that it fits your foot. And it does come in different sizes. But the key to this is this one right here, because that, you know, normally your foot's going to go down like this in plantar flexion, and this actually, you pull this strap and pull it forward. You know, it's got to be comfortable. My wife woke up one night, you know, she had to loosen it up obviously, because it was keeping her awake.
This strap was pulled too tight?
It was pulled too tight.
Sure.
You probably want to pull it as tight as you can comfortably stand it.
Right.
You know, because it puts that stress on it. So, you know, I had a patient or two use this before, and it did help, but I didn't know if it was that or all the other things we were doing.
Sure.
But in her case, it really was dramatic.
Yep.
I mean, it was the thing that made the difference. So
I just wanted to point out the thing I like about this type of brace is it has an open bottom. Some of them come around the bottom, the back side in here, and then the strap pulls up. But then when you get out of bed, you can't walk on it near as safely or comfortably because you're walking on a
If you get up to go to the bathroom in the middle of the night,
Right.
Like I can walk on this without a problem.
Go ahead, show them. So yeah, if you get out,
I don't know if Lonnie can see me, but so
you could probably go running with that.
Yeah, you probably could. So
we don't recommend it, of course.
So again, I looked up the studies again on PubMed.com. That's a government institution site, and if you can look up some of yourself, there's lots and lots of studies on this.
Plantar,
So,
all right. Well, good luck with keeping your feet healthy, and I don't know what say you, Bob.
He loves that saying. Thanks for watching.